you guys later. Good girl.
Miss Molly. Come on, Miss Molly. Come on. Good girl. Whoop. Oh, no escaping. Back up.
Oh yeah, she's an estate artist.
So we have to make sure that these are locked.
Yes, because you're not pushing them. Nice try.
Okay.
Sit.
Good girl.
She's 48.7.
Hi, I'm Dr. Jennifer Edwards, and I'm here with Mel, one of my veterinary technicians, and Molly, the Bulldog. And Molly is one of the dogs at the Animal Rescue League, and what we're going to be doing today is we're going to be spaying her. She had come into the shelter a few weeks ago and has been very underweight. They've been trying to put some weight on her. And she also had a bleeding discharge from her vulva. So some questions were raised as far as, had she had puppies, was she in heat, or did she have something called pyometra, which is when they get a infection in their uterus, which occurs in older unspayed female dogs. The discharge appears to have resolved today, which is good, and based on her teeth, she seems to be very young, so that makes me think that pyometra is much less likely as a cause of what the discharge was going on. So what we're going to do today, I've done a complete physical exam on her. I wanted to check and make sure there's no heart murmur or any other problems, and everything seems perfect other than she is significantly underweight. So today we will place an IV catheter into one of her front legs, and we will have her on fluids during her procedure, which helps to maintain blood pressure and blood flow through the kidneys. And basically we will put her under general anesthesia and we will spay her. Her spay today will be done with a laser, which is very nice, especially in a case like this, because it helps to significantly decrease any bleeding or pain associated with the procedure. And given that she has recently been in heat or had puppies, her inside parts are likely to be very engorged and developed, and so the laser will help us to not have to deal with some of those blood vessels quite as much. And basically after she is spayed, she's going to go into foster care until she's ready to be adopted, and given her wonderful personality, she is a complete love. I really doubt that it's going to take long once she goes up for adoption to find her a good home. So she'll be on her pain medication for about 5 days post-op, and she's getting sick of being on the table, and that will be it. So I'm, not anticipating any problems today. Everything should be fine, and we'll get started. We have everything in the computer, but especially on days where we have multiple patients, we still write it on the board because it's just kind of a one-glance visual, and that makes sure that nothing gets forgotten. Okay, so what we're going to do now is we're going to give Molly her pre-medication drugs, and what these medications are going to do, she's getting 2 different kinds of pain medication, and she's getting a third medication, which is also for pain and also helps her to get sleepy, and an antibiotic injection, which we don't routinely do antibiotics for spays, but just because of her history and uncertainty regarding infection, we're going to do that today for her. And normally we would put her catheter in first, but she was struggling with us, and since we don't want to have to really use a lot of restraint on her, we'll give her these first, let her get a little sleepy, and then put her catheter in. Right? Right? You can't eat it though. No. All right, sweetness. You ready? Okay, good girl. Good girl. Oh, it's okay.
Good
girl.
Okay. Good girl. Who's a good girl? Yeah. Oh, don't trip on me.
She looks straight.
She looks straight into the camera. She loves it. She's like, adopt me. All right, honey.
Les is definitely more.
Yeah, she just doesn't like to be restrained. It's okay. Good girl.
Is there a reason why you do it in different places?
The first injection was done into the muscle, so I did it in the musculature in the hind leg, especially on her. She's got nice big muscles back here. And then these next two injections are both just under the skin, they're subcutaneous, so they can go anywhere. Basically, they're just going to absorb from under the skin. And given that she has so much skin up around her neck area, it's just convenient. All right, come here, Miss Wiggles. Come on. Good girl. One more. One more. Good girl. All right. Okay. It's okay. You're so brave.
Okay. Are you done? Are you done?
So now what we'll do is give her a few minutes and let her get a little sleepy, and then we'll take her out and put in her catheter. All right. Kennel? Kennel? Good girl.